I'm just going to hand the stage over to Ms. Sarge. He's going to talk for 5 or 10 minutes, and then we'll open up the floor to questions. So, welcome to Sarge.
All right. Hello. Good morning. Can everybody hear me? Yeah? Talk louder? All right. Is this better out here or closer to the mic? All right. All right. Welcome to Cannabis Con. My name is Nishar Patel. I'm one of the research coordinators here in Calgary at Harvest Medicine. It's one of the cannabis clinics here. By a show of hands, who here is out of town? All right, excellent. So we have a lot of out-of-towners as well as lots and lots of local people. Okay, so welcome everyone. So today's first presentation, I just want to introduce everyone to cannabis and how cannabis is seen in the clinic, specifically at our clinic, which is located all the way in the Northland Mall in the Northwest. One of the things that we do over there is provide exceptional education to our patients, whoever wants to know about how medical cannabis can help their clinical conditions, things like pain medications, managing as well as some mood disorders, as well as some sleep. And one of the things that we start with at our clinic is providing our patients with some simple education. One, medical cannabis is legal. Okay, this seems to be a huge confusion with recreational cannabis. And our goal at our clinic is to help our patients understand some of these things. So, one of the first things we start with are 2 main bioactive ingredients of cannabis, which are CBD and THC. THC being tetrahydrocannabidiol, okay, that's the psychoactive component. That's the one that gives you the high, okay? That's what everybody knows. Very, very popularized with its symptoms of anti-nausea and the appetite stimulation component, which everybody knows. And also it helps modulate some pain and sleep. Now, in contrast to that, CBD, which is the non-psychoactive component. Are you struck by a new thought? I was the first time I came across CBD. There's a non-psychoactive component of cannabis, which does not give you the high. But it has been popularized mainly for its anti-inflammatory components, as well as its pain reduction, and recently in social media and all over research for its anti-seizure properties. And I'm sure every one of us here has seen Netflix specials or some documentaries out on YouTube about how CBD specifically has helped seizure patients. So after some of these basic Cannabis 101 information, which you guys are all getting a taste of, we provide our patients with some clinical oversight from our prescribing physicians, who I help along with our Canna Geniuses at the clinic. And after our patients have been, they go through the entire clinical assessment process, and then they get introduced to our Canna Geniuses. That's right, they're called Canna Geniuses, and it's mainly to provide guidance and some support to our patients. And a lot of the times, new patients need the extra guidance in order to help them choose a specific strain, maybe even a different type of cannabis, for example, oil extracts. So, when we talk about cannabis, there are 2 main routes of administration, okay? The ingestion route, which is by mouth and is absorbed by your stomach, okay? And the other route is by the inhalation route, okay? Vaporizing, which is often confused with vaping, which is very different, and we can go into more details in the Q&A section. And vaporizer that I mentioned, so we'll also go in detail about the different vaporizers that are available through licensed producers. And the ingestion route, which is mainly focused on the oil extracts as well as their derivative products. And after the patients have been provided the clinical education and the oversight with prescribing physicians and the different products that are available through the licensed producers, and again, in the Q&A section, I can go into more detail about the licensed producers and the different products that are available through them. They are provided with a full 3-month follow-up when they come back to our clinic, depending on how their medical cannabis therapy is going, and if medical cannabis is helping them meet their goals of therapy. And I follow being one of the research coordinators at Harvest Medicine, we follow qualitative as well as quantitative measures, and two clear trends that appear out of it. One is drug management of chronic illnesses. Okay, for example, chronic pain, chronic mood disorders. And the second trend that clearly emerges, which is a qualitative trend, is improvement in quality of life. And one of the reasons, one of the main goals at Harvest Medicine is to help our patients understand what medical cannabis really is and help them guide in that direction. Because at the end of the day, our goal is to help our patients with medical cannabis and how it can help them achieve their goals. Okay, I know that cannabis as a whole, especially from a medical cannabis perspective, can be confusing. So I'll open up the floor now for questions, and we'll take them one by one. Perfect. Right. So we're just going to have the mic passed around, and you guys can just stand up and maybe introduce yourself and clearly state your question, please.
I know you're all itching to ask a question.
Hi, my name is Karen. I'm from Cannabis at Work. Can you explain the differences between vaping and vaporizing?
Sure, yeah. So vaping and vaporizers. So there are different types of vaporizers that are out on the market. You'll see different patients people using the nicotine vaporizers, which are very common. They have the liquid inside it, which is the nicotine, liquid version of the nicotine. But the vaporizers that are used for medical cannabis actually take the dried cannabis, okay? And in comparison to vaping, which has been popularized on the illegal side of things, where you have the e-juice and e-pens and all these things, which are based in glycerol, and they have really, really harmful toxic effects that actually very common one that is popcorn lung. I think that's something that people have been talking about a lot, which is something that I don't want to get into too much detail, but if patients are switching off from smoking, for example, smoking cigarettes, and switching to a vaporizer, the damage has already been done to their lungs. So over time, as they switch over from the smoke to a vape, that clearly gets defined. So there's more detail that a prescribing physician could probably provide, but that's the main difference.
Any other questions?
Guys, the goal here is to, open up the floor to any questions, all right? It's Cannabis 101, so ask any question that is possible, okay?
Hi, good morning.
Good morning.
My name is Kirsten, and I am an employer in the heavy construction industry. And of course, I've been tasked with writing our policy. So one of the things that, of course, we're very concerned with is on the medical side, the recreational side. I mean, we're going to be treating as alcohol, that's not a good thing.
Sure.
But on the medical side, is there any confidence from the medical community to be able to, when you've prescribed medical marijuana to one of our employees, are you able to tell us whether or not this person would be considered impaired when they're on the job, what sort of timeline, that sort of thing? That's really what we're looking for.
Okay, excellent. That's a really good question. So a lot of the times the discussion of cannabis starts with impairment, right? Everybody is worried about that, and everybody should be worried about that. Because THC, the psychoactive component that many people know already, impairs you. It definitely does, okay? And anybody who tells you otherwise is definitely lying, okay? But CBD has been defined by the body high, right? But it does not give you the psychoactive impairment. So a lot of the times, the focus from our end at our clinic is that we clearly instruct our patients. If you are using THC, no driving, no operating heavy machinery, let your, give yourself sufficient amount of time depending on the routes of administration you're using. So for example, inhalation route tends to stay in your system for about 2 to 4 hours. Again, it is dose dependent. And the ingestion route tends to be about 4 to 8 hours and can be longer, again, dose dependent. So when patients are on CBD, and specifically CBD, they're not impaired, right? And we've seen many of our patients who, because of the social stigma around medical cannabis and its use, they just don't report it. And we clearly instruct and we try to counsel our patients into having an open conversation with their HR manager to allow them the time and the courtesy to understand medical cannabis, what the different components are, and hopefully, depending on the company policy, they will respond. So, I hope that answers your question.
Anyone else?
I might be able to talk loud enough about the microphone. Hi there, my name's Morgan. I'm an accountant, but my questions actually follow on to her. Is there a threshold with THC where below that you're not actually considered impaired?
That is a really tough question because different sensitivities. Sorry, what was your name again?
Morgan.
Morgan, hi. So it is a tough question because it is dose dependent, and because it's dose dependent, the effect that it has on individual patients can vary. Now, there is a certain threshold which it's concentration dependent, and usually it's considered that less than 2% of THC in a medical cannabis product that has mainly CBD is considered non-impairing. Now, if you end up having CBD a lot, that has the less than 2% concentration, the concentration is going to increase in your body. So if you have a low threshold of sensitivity, then you're going to respond to it. So there is a gray area there, which is being, that's where the regulation and prescribing physicians as well as research coordinators kind of come together and have this discussion.
So follow-up question. So in an employment context, would an employee be able to get a physician to state on this dose they're not impaired if they follow it, or is that something that's not clear yet? Because obviously this is going to matter for everyone's policies.
Right, exactly. And so right now, our prescriptions are CBD. Whenever we do CBD mainly prescriptions, there's a clear indication of restriction of THC less than 2%. So the patient having access to CBD products, they will not have any access to THC products that are more than 2%. And they're also a milligram to milliliter concentration limit as well.
Who else would like to ask a question? Coming your way.
Good morning, Dr. Patel. My name is Thomas. I had a question regarding the medical opinion and any knowledge studies that you've done on the effectiveness of topical cannabinoid medicines, CBD creams, and such.
Sure. So topical creams tend to be very difficult to manage. There's a specific molecule, and I won't get into the detail of it. It's called DMSO, and that molecule has to be in any medication or any topical cream that has to pass the skin barrier. And if that is not in it, and that has to be registered first of all to Health Canada, but if that is not there, then there's no clear indication of topical creams working as far as cannabis derivatives go. So there have been some anecdotal evidence of patients using CBD oil directly on affected areas. For example, psoriasis is a very common one. Arthritic joints, if patients don't want to ingest it. But as far as the efficacy of some of the topical creams go, there has been no clear evidence for that. And I think more research as we go forward will come out, and hopefully that will serve that.
Good morning, my name is Rex Carey. I wanted to ask where we are on the spectrum of regulated testing for impairment and then regulated testing for illnesses.
Unfortunately, I'm not the best person to ask about that, and I think some of the speakers that are coming up after me and later today will be better able to answer that question, because the prescribing physicians and the group of physicians that are involved in that are very different from myself. I focus mainly on the clinical aspect, where I provide education to patients, and our research is mainly local. And our goal is to actually start some of the trickle-down clinical research, but when it comes to basic science research, which is what that refers to, it's not something that I'm involved in.
Good morning, Irina Bloomer. I was just wondering, how does either cooking with it, so heat or freezing it, affect the component of the CBD or the THC?
Yeah, so there have been different methods of ingestion. I mean, cooking is a very, very popular one. We have patients who take their dried cannabis and turn it into cannabis butter and use it for different baking goods, for example, cookies and cakes and stuff. But the effectiveness of the THC and the content of CBD and THC, if done at home, can vary, right? Everybody cooks differently. And that is the reason why cooking is something that is cooking the cannabis is not something we highly recommend from the medical perspective. We prefer that our patients stick to the dried cannabis or the oil extracts, because that way there's some sort of standardized approach to dose management. Because we will have some of our senior patients, they will try to cook their CBD oil into say, for example, their banana bread in the morning. But one batch of banana bread is really good, and the other one makes their pain come back. So it's almost we don't usually recommend too much on that, because of the difference in cooking.
Hi, my name is Dan Cochran. You seem to focus constantly on the THC and CBD components, but have you seen any research or benefit in regards to the terpene profiles?
Yeah, excellent. So I wanted to talk about the terpenes at the end, actually. So terpenes are a third component of cannabis, and actually a major component that's making a comeback, mainly because of its therapeutic effects. And a very, very popular case was reported in Israel, where a cohort of Down syndrome patients were using dried cannabis. And when a dried cannabis batch switched over, there was a component that was missing, which was the terpene profile, and had a huge impact on how the Down syndrome patients were performing. So terpenes are, so for everyone's information, terpenes are a third component. They tend to affect the smell profile of a lot of the dried cannabis, but also have therapeutic properties, for example, anti-inflammatory component, as well as some pain relief. And they are an emerging compound that is not really focused on the medical side. We provide the information, and at our clinic we do have, when we provide the information, there's a full page where we kind of classify and categorize the different terpenes, for example, the carbophyllines and the myrcene, and hopefully the therapeutic effects that we're hoping to achieve. Not clearly defined just yet, though. But you will see, them on licensed producers' websites where they have classified them. So I think going forward we'll have more information about that.
Who else has a question?
There's the person. Am I talking too fast for anybody? Raise your hand.
Good morning. My name is Neil. I'd like to know if you could comment on using medical marijuana as a replacement for chemotherapy, and most specifically for using it for ovarian and or cervical cancer.
So that's a really good question, and because I'm not a prescribing physician, I will avoid answering that question. And I think a better person to ask that question to is a oncologist who follows, say, cancer therapy, as well as the full, therapy for a patient who's going through treatment. But again, I can't comment on that because I'm not a prescribing physician.
Who else has a question?
Right there.
Dennis. It's not really so much a question. I just wanted to comment on this question earlier about the cooking and freezing of it. And it's been my experience that one of the greatest factors in cooking is the consistency of your temperatures. I'm somebody who's actually a journeyman cook with a science degree and an enthusiast. And so I've played around with it quite a bit. And I find that if you have fluctuations in your temperatures, you're you're decarboxylating your CBDs in different ways. That's where you get your variations. You can take the exact same bag, so to speak, cook, you feel like it's the same way both times and end up with a different product. Well, was your oven preheated the same way? There's so many factors that come into play. It's been my experience, though, if you do maintain these factors, that you can get a consistently good product. But decarboxylation is kind of key to it, and that can be done at a consistent temperature oven, prior to cooking the product. I also wanted to comment on freezing it, and I don't recommend freezing your marijuana. If you put it into a freeze-dried freezer, frost-free freezers will extract the moisture out of them. Okay, so you'll dry your pot out. But the other thing too about putting marijuana in the freezer is that you can actually expand and break the trichomes, which are the crystals on it. And so you're actually damaging the marijuana by putting it in the freezer. The best thing to do, in my opinion, is to put it into a vacuum sealed bag, not really, really tight, not like the vacuum seal sort of crushes it, but put it into a vacuum seal so it's maybe 80% vacuum sealed, and keep it in your fridge. Or keep it in a jar in your cupboard out of UV exposure, and that'll avoid decarboxylation too, which occurs by UV exposure. So, anyway, sorry. I hope if anybody's interested.
That's an excellent answer. And this clearly goes to show, right? And this, by definition, goes to show that there's some people out there that are very, very experienced, and they have the idea of how to manage different cooking methods. And there's tons of patients that don't, and that is the reason why cooking is something that we usually don't recommend, again, because of the inconsistency. Thank you so much.
Who would like to ask this question?
I thought so.
This is a really easy one. So right now, the methods are dry and oil. What other forms will be available soon that you're aware of?
Okay, I think that's a better question for the licensed producers that kind of come up, right? So different products, right?
Right now, you have access to LPs, right? That's who you're ultimately referring your patients to. And they have access to dried and oil. Okay. But I know that is a great question for LPs, but I'm wondering if you're aware if there's anything else. I know that some LPs are offering the combination of oils with topical creams. So
That's right.
Yeah.
That's right. So one of the popular, I think you're speaking of Med Relief. I think
Yes.
they're the ones that have them.
Yes.
And they also, and actually I think Tweed has a vaginal cream as well available. But remember that all of these products are all based in the oil extracts. So their efficacy will be the same as the oil extracts. I think they're trying different products out there, but again, I don't think I'm the best person to ask about that.
Thank you.
Just to expand on that a bit, there's also, we're seeing more sprays. Hydropothecary has a mint spray, and I believe there's one other product that they're working on right now. And I would imagine that many of the licensed producers are at least doing R&D on things like vaporizer pens.
That's right.
With an expectation of that coming in the coming years. So that's a product we're seeing in the States that is becoming more and more popular. Other patients are looking towards, so I would imagine there's a lot of R&D going towards that. Another one?
Maybe he should make a presentation.
I have no comment about that. I just have a question though. I have seen a vaporizer pen and I actually was a little bit alarmed by it. It advertised a normally high amount of THC. I think it was alleged at about 49% THC. And the CBD was non-existent. And from a recreational standpoint, I have a concern with such an imbalance on a plant that was 25 years ago, very well balanced at a 2-to-1 or 3-to-1 THC CBD ratio. And when I see products that are being made available for the public where, you're looking at a 5,000 to 1 or, infinite to zero kind of ratio. Is there any concern from the medical industry and from Health Canada and from the industries, that recreational pot users are losing out on the benefits of CBD? For instance, I've heard that CBDs can counteract the long-term impact of THC use against the frontal lobe. So again, having not had a generation of marijuana users who've been consuming high THC, low CBD ratio, we can sort of ad hoc look back and say, well, it doesn't seem to be causing a problem. But the marijuana today is dramatically different. When you're looking at 25% THC and 0.01 CBD, and now these vaporizer pens, which they, the double the score on that. Is there any discussion on this? I mean, am I off base?
Yeah, so I can't speak for Health Canada as well as I can't speak for some of the other clinics, but our goal at Harvest Medicine is to focus on our patients into medical cannabis for one. And one of the reasons, one of the things that we instruct our patients on is the difference between the products that are available to them, because you can access these other illegal products, but under the ACMPR, the Access to Cannabis for Medical Purposes regulations, which is by Health Canada, there are only oil extracts as well as the derivative products and the dried cannabis produced by the licensed producers. Those are the only ones that we instruct our patients to follow and to use. Now, as far as the recreational side goes, again, that is completely independent from the medical side, and we tend to avoid it. And that's the reason why there's a multitude of products that will be available through the recreational market, say, considering what happens over summertime. Our focus is mainly to guide our patients if they need help with CBD, all right, non-impairment version, non-impairing component, to manage their inflammation, to manage their pain and their anxiety. Okay, so we have CBD products and we guide them towards different licensed producers who have CBD products. And that's something that we will likely not see on the recreational market. CBD products will likely be, the variety that is available will be much lower.
We have about 5 minutes left, probably time for 1 or 2 more questions. If anyone in the audience has a question for us? Well, I actually have a question for you. I'm curious if you could talk about the sort of misconceptions that you see when people come into your clinic about not only the access program, but about cannabis itself.
Oh yeah, so that's an awesome question. So one of the 4 most common things that we see from our patients when they come in. One, I don't want to get high. That is one of the first things that patients ask about. I don't want to get high. There's been, it's just something that people talk about and they're just very afraid of. And one of the things that we like to talk to our patients about is the CBD component. Okay. Also, one of the common misconceptions is that the cannabis clinics promote smoking. Absolutely not. We do not promote smoking. We clearly instruct our patients to deviate away from smoking cigarettes or any combustion method that they might be using and focus on vaporizers, for example, or using oil extracts. And actually there has been some literature out there that's been shown to reduce, help you actually quit your cigarette smoking by using vaporizing root of cannabis, right? Also, another common misconception is that it's THC. Is it going to make me go crazy? Is this going to make my memory go out of whack? No, there's some impairment that is there for depending on the dose, depending on the dose that you took, and considering the inhalation route or the ingestion route. And after that, the cannabis is actually just stored in your system for about 40 days, and after that it's excreted. Okay, so those are the common misconceptions that we see, and then we hear everything from cures to cancer all the way to this is the worst thing I've ever seen. So what we like to focus on is the education component, help them understand how they can use THC and CBD, and then go from there.
We might have time for one quick question, otherwise we'll be moving on to the next panel. Does anyone have one last question?
I'm Robbie. Can you just talk a bit about the cannabinoids and the endocannabinoid system? How plant actually, a lot of people don't know how or why you feel about this plant.
Yeah. So first of all, awesome T-shirt. I'm a huge fan of Green Lantern, so I use that in my med school interview. So, the basic sciences, I don't want to get you guys too confused about it, but the things to focus on are CB1 receptors and CB2 receptors. Okay, and THC and CBD both as molecules bind to them. Now, where the receptors are found is where the effect happens. So CB1 are more concentrated in the central nervous system, so the brain, okay? And the CB2 receptors are mainly in the peripheral nervous system as well as the gut and the immune system. And that's where we see a lot of the effects. So for example, THC, because the concentration of CB1 receptors is higher in your brain, you get the psychoactive component, but you also get the sleep aid, which is controlled up there, as well as some pain modulation, right? So that is all up there. But with CBD, which binds more, which is more prevalent in the CB2 receptor, which binds closer to, has a higher affinity of binding to CB2 receptors, which is found more in the periphery, so out in the body, hence the body high, the lowering of inflammation from the immune system. So when it comes to layman understanding of cannabis and how the physiology works, CB1 receptors, CB2 receptors, THC and CBD both bind to them, and where they are found is where the effect happens.
Okay, we can get a round of applause for Dr. Patel. And I'm sure he will be around all day if you have more questions for him.
Thank you so much, and you guys have a great rest of the day. Please stay warm and drive safe, okay? Thanks again.